Hello, everyone. Welcome to this HBNU webinar. I think more people are still joining. We are going to wait for 1 minute and we start once we have everyone joined. Hello again and welcome everyone. Thank you for joining us today in today's HBNU webinar. My name is Patricini Tegeka. I'm the Program Director for Nutrition and Global Health Program in the Department of Global Health and Population at Harvard T.H. Chan School of Public Health. And I'm the Program Manager for the HBNU Fogarty Global Health Consortium. It is a consortium that brings together 4 universities: Harvard University, Boston University, Northwestern University, and the University of New Mexico. That's where the acronym HBNU came from. So the purpose of today's webinar is to give you an overview of the program and to answer any question you may have. Today's speakers will include Professor Wafaie Fawzi, who is the principal investigator for Harvard University. He will give you the overview of the program and we go through the application process. We have the chance to hear from 2 alumni, Dr. Anubha Agarwal and Dr. Alida Gertz. They will both share their fellowship experience. Anubha was the fellow for 2017 and 2018 cohort, and Alida was the fellow for the 2018 and 2019 cohort. We also have Dr. Mark Huffman with us, who will moderate the entire session. Just a little housekeeping before we get started. If you have any questions during the presentation, please type it in the chat box of your Zoom platform. Mark will bring those, we go through those and you bring them as we continue during the session, but we will also have a time for questions at the end. The webinar will be recorded, and if for some reason you miss anything, don't worry, we will share a copy of the webinar via emails. So now, without any more delay, I'm going to turn the time over to Mark. Thank you.
Thanks a lot. Thanks, Patrici, and good morning, good afternoon, and good evening to everybody for today's HBNU Fellowship Info Session webinar. My name is Mark Huffman. I'm the Quentin Young Professor of Health Policy and Director of the Center for Global Cardiovascular Health at Northwestern. I have a secondary appointment at the George Institute for Global Health and University of New South Wales in food policy. And really excited about today's webinar, really pumped that you guys are all on the call to be able to get some information, and we're excited to receive your applications. So we've got hopefully a useful 50 minutes ahead of us. And so Wafaie Fawzi is going to kick us off. He's the Richard Saltonstall Professor of Population Sciences Professor of Nutrition, Epidemiology, and Global Health, and he's our fearless leader of HBNU. So Wafaie, take it away.
Great. Thank you so much, Mark, and welcome everybody. I am also delighted that we have this opportunity to share a little about the fellowship program and look forward to any questions and to your applications. So we have a series of slides that we will run through as I present, and you will have these also as part of the recording. So this is a program that is funded by the Fogarty International Center. Many of you are familiar with NIH, the National Institutes of Health. That really has a series of centers and institutes. The Fogarty International Center is particularly devoted to elements of research training. And they have a series of training grants that enable various US universities and partners in low and middle income countries to come together in ways that advance capacity of future leaders in health and global health more particularly. Many of those training programs that you might have heard about tend to be more focused on one US university and one country. The HBNU is in a family of training grants that really is unique, and it allows a number of US universities to be on the same program together with a number of LMIC institutions. So it is one of several consortia. Fogarty and Dr. Roger Glass, who is the director of Fogarty, always speaks of this particular program as their flagship training program, and you'll see why that is the case as we go through. HBNU, as Patricia has mentioned, is made of 4 US universities that are on the slide in front of you. Within each university, really it's a partnership of a number of schools and hospitals and units that are interested in global health. At Harvard University, it's moderated through the School of Public Health, but it reaches to the medical school, to all the affiliated hospitals, to the dental school, and to other schools at Harvard as well. And the same goes for Boston University, Northwestern, and University of New Mexico. We are one of several consortia. There are others, and happy to answer if you have any questions about the other US consortia. These are the principal investigators on the slide in front of you. And you can see Mark and myself there, but there are other colleagues who are leading this effort with us, and you'll have a chance to interact with them as the application process goes on, and hopefully as you are part of the program, if everything goes well and you are indeed one of the cohort for next year. There are 4 US universities, but 21 partner sites in Asia, Africa, and South America. And they are listed here on the slide in front of you. It's obviously not possible to be in all countries, and we have deliberately really focused on a smaller subset of countries to be able to really have a critical mass of fellows and engagements with these partners. But each one of these sites in Asia, Africa, or Peru particularly, are sites and universities that have long-standing relationships with one or more of the US universities. So decades in many cases, relationships with ICDDRB in Bangladesh, or University of Ibadan in Nigeria, or Cayetano University in Peru. And through this program, hopefully you'll have the opportunity to tap into long-standing relationships and ongoing collaborations and projects that are existing at those sites and in the US. Just a brief overview of what the fellowship program is about. It's a 12-month program. It's really focused on research training. So there is an element of research, but the emphasis really on building capacity in doing research. And through the process of engaging in a particular research project, one would have an opportunity to advance that research question, but also learn methods, learn aspects of analysis, engage with field experiences, and develop relationships and friendships with partners in the network overall. The areas of focus are noted. HIV/AIDS is one key area. Maternal child health and nutrition is a second. Mental health is a third. Non-communicable diseases, including cardiovascular disease, obesity, diabetes, and others, cancer is a fourth. Dental health is another one, but I'd like to emphasize that these are sort of broad categories, and there are elements of global health that are not noted on this slide, but they are still an aspect of interest for the NIH and for this particular program. So an example would be, we don't say on the slide cancer, but it would be sort of important to recognize that it is a big issue in global health, and there are mentors and there are projects that would be possible to engage with. Questions around global surgery are asked about regularly by potential applicants, and that is an area of interest as long as it has some specificity to a particular aspect of global health, such as the surgery relating to maternal health and obstetric surgeries, or surgeries associated with cancer. And so any item of global health that is the interest of one of the NIH institutes would be a fair area of focus for a prospective fellow who is interested to apply. I'll come back to the types of applicants that we are looking for. The fellowship overview is on this slide. Essentially, it's a 12 months fellowship, as I mentioned. It starts with a 1-week orientation at the NIH. Essentially, all selected applicants from HBNU and from the other US consortia meet at Bethesda Fogarty International Center and NIH in July, and thereafter kind of span out to the rest of the world to be based at the LMIC site for the remaining part of the fellowship. During the year, each fellow would be mentored by a team of mentors, a US mentor and a site-based mentor, who would guide the fellow in his or her own work, his or her own opportunities and aspirations to gain insights into field research and design, ethics, analysis, etc. Some of the engagement happens through monthly seminars that we bring the cohorts together in webinars like this one, where we hear progress and share tools and skills and competencies around aspects of design or proposal development or IRB issues or data analysis, etc. And we receive progress reports from each fellow on a regular basis to be able to support the ongoing experience as the fellowship gets underway. I mentioned briefly that it is a 12-month fellowship. While the fellows are in the field, there are obviously some expenses, and these are typically supported through a stipend that the training program provides. The program also provides a modest research support to enable a research question or project that you would like to pursue, as well as it covers costs for travel, accommodation, health insurance, and the like. These are aspects that you sort of put together as part of your proposal and as part of your application, and happy to go over that and answer any questions that you may have. These are briefly the eligibility criteria, and one of the unique features of this program really is that it brings together US fellows and LMIC fellows in the same cohort, and many times in the same country where an experience is happening. So applicants, by extension, come from both US and from those 15 countries where our program is based. We are happy to get applications from pre-doctoral students, US pre-doc students, those who are enrolled in a doctoral program, but also postdoctoral fellows, both US and LMIC postdocs. One other unique feature of the program really is the sort of multidisciplinarity of fellows, their interests, and by extension, the mentors and the projects that our community is engaged in. So there is a lot of opportunity for folks in public health and medicine, clinical fellows, residents, PhD students, postdocs who have finished a PhD in public health. But beyond that, it's really open and encouraged to engage with colleagues from other backgrounds who are important to global health, from education to engineering to pharmacy, dentistry, nursing. Sort of global health is a big tent, and these various disciplines are all critical in answering important questions. And if you are in one of those domains, by all means, we would love to hear from you. Briefly on expectations, some of it is perhaps obvious. You know, attending the orientation in July is really an important aspect of the program. It provides the opportunity to meet with other fellows across the network, both from our 4 US universities, but also from other sites and from other parts of the NIH, really meeting with a number of leaders of NIH institutes in a way that's quite enriching as you start thinking about your own research questions beyond the fellowship year. Another expectation, obviously, is to be based on site. This is a fellowship that is enabling and sort of providing the setup for a field experience and research training in the field. So 11 months abroad is part of the plan that's fully supported and mentored by US and LMIC mentors. There are aspects of reporting that are mentioned on the slide. Really, they are not onerous reporting, but they are important clearly as mechanisms for us to keep track of how you are, what challenges you are facing, in addition to the regular weekly or bi-weekly or engagements that you would have with the site mentor and your US mentor. As a larger HBNU, we like to keep track and come to your support in any ways that you think are needed throughout the period. We're happy to elaborate on those reporting, but as I said, they are really not onerous, and perhaps no reason to worry too much about them at this point. The application process is briefly noted on the slide, and you probably have seen some of that a little bit in the flyer, or if you had a chance to look at the HBNU website. Essentially, you choose a research area, and you know what is your area of interest, be it HIV or MCH or NCDs or mental health, or an aspect really that's not mentioned, but it touches on these elements, and we're happy to guide you in that regard. You choose a site. You can be only in one place, obviously, at the same time. So pick one of the research sites. And then you choose your mentors, a mentor at the US institution and a mentor at the LMIC site. There are mentors that are listed on the website in both LMIC and Harvard Northwestern, BU, and UNM. If there are mentors at these sites that are not named, we would be happy to engage with you and with that person to add them as mentors. It's not a complete or exhaustive list of mentors, and we are always adding potential mentors at 4 US universities and LMIC sites. And beyond the mentor that you choose, one from the US and one from the LMIC, really as the fellowship gets underway, you have the opportunity to access really every other faculty within our network in ways that typically are possible, and our faculty are generous with their time to engage and support you in ways that you would be needing. Although most of your work would clearly be deeply engaging with the particular mentors that are identified for your work. And then you submit your application online. It's a straightforward application. There is a component of letters that are needed. There is a research project that you have to write about. There is a budget that you need to put together for the research that you would like to pursue. And you would name the mentors and the site that you have clearly identified. It is straightforward, but there are questions that arise, and you have emails towards the end of this presentation that you will feel free to access and ask any questions if the time today is not adequate. Here is briefly the timeline. This is my last slide. So the deadline is November 1st. Applications are rolling in as we speak. It's never late to sort of put in your application. We go through an application review and selection in November and December, and really aim to notify candidates as soon as possible by the end of February at the latest. We engage with the Fogarty International Center once we have identified candidates and have a final confirmation thereafter in about March or April, and look forward to meeting the new fellows in July for orientation. That's all from me for now. I pass it back to you, Mark, for next steps.
Great, thanks a lot, Wafaie. And I hope for everybody who's attending the webinar, please use the chat function to ask questions to Wafaie. I know he and I and others are interested to try and make this useful and functional for you. Maybe a couple things as you're thinking about your questions of, when reaching out to potential mentors, be persuasive, right? Make a compelling case on why this person who may already have some mentees or projects, why working with you would be mutually beneficial. What are the skills or experiences that you bring? How can you support maybe existing or ongoing research activities? Those tend to be relationships that are often more fruitful, and the applications tend to be more compelling because they're not only feasible, but it's easier for the review committee to be able to see a pathway towards long-term success, not just getting the projects completed. So just giving you a little sort of tips and, what are we looking for when we're evaluating proposals? So any questions from the attendees? Well, Dr. Joseph, yes? So is a fellowship twin, that is someone in an LMIC who will be a Fogarty Fellow working on a similar project, something to consider? So Allison, thanks for your question. This is something that is usually done after the fellowships are awarded, and to try and synergize activities within an existing site. It's not a requirement. It can work, but I would say that the more important relationship is between the applicant and the mentors rather than two applicants. Now, there's likely infrastructure at an institution that can, can make that compelling. but also know, we have a limited number of spots that we are able to award, and we have a fair number of sites. And so we are interested in diversity on a lot of different levels in terms of the applicants, but also the sites, the topic areas, some of which is driven by the funding streams, whether they're for the various domains that Wafaie had alluded to. So I think that those are some considerations. I hope that helps a little bit. Thanks, Allison. So Joy said, thanks for potential for including mentors who are not currently listed. As this is a formal process, usually it's reaching out to the mentor and then reaching out to us within HBNU about that. I would say most recent example here at Northwestern, Dr. Chris Kuzawa, who's a professor of anthropology, and his mentee, Andrew Kim, is a PhD student, had applied. Chris wasn't listed, but he's an outstanding investigator. Very compelling proposal, very compelling institutional infrastructure within South Africa. And so, I mean, it's an ongoing discussion, I think, with us at HBNU, but also internally. You're trying to make this case of why this person would be great. So we're, as Wafaie said, it's not hard and fast. We're not always able to cover everybody, but they need to demonstrate their interest in participating in this program. If you're not registered for a PhD program, there are other doctoral programs that if you're part of, then you would be eligible as a pre-doctoral candidate, but you need to be within a doctoral program to be considered a pre-doctoral candidate. I hope that helps. With that question.
I could add one point, sorry, Mark, on the mentors. That's the other thing that sometimes comes up is a potential applicant doesn't know who is the right mentor. In some cases, in many cases, you know exactly, and I would be persuasive in the ways that Mark has indicated. But if you are not sure, feel free to connect with any of us, and I'd be happy to identify somebody and propose. Then you would obviously ultimately have to look through and see if that's a good match for you or not.
Thanks, Wafaie. Yeah, please, and obviously step in if you've got other comments. So is fellowship open to medical fellows from Jonathan? Yes, absolutely. Does Bokar ask, does someone at his first year PhD is eligible? Yes, pre-doctoral is eligible. Kalo asks from Botswana, I want to spend 6 to 9 months in Harvard University lab learning techniques that I transfer back to Botswana after I finish. Is this permissible? So there needs to be 11 months in the field. So 6 to 9 months out of a 12-month program would not work. But the following year, for example, that may be a way to think about combining some of that learning and bringing it to Botswana. How do you consider postdocs from SIDNA in terms of years of postdoctoral training? Really pretty broadly. I mean, some people, it's their first year after they've completed either their MD or their PhD, others further along. So there's not really an open-ended period. These tend to be early stage investigators, someone who's a professor of medicine and applying for a Fogarty postdoc, that's probably not quite the right phenotype, is maybe too far along in the pathway. So yeah, hopefully that gives you a little guidance there. Are we allowed to do clinical application project related? So these are clinical research fellowship training fellowship positions. So clinically focused research is definitely encouraged. Strictly basic science research has not traditionally been an area that Fogarty has funded. That is pretty all-encompassing, meaning that if the cells are coming from patients or the samples are coming from patients, I mean that works. But something that is exclusively a mouse model or something like that hasn't been funded and hasn't really been eligible for funding. If you have questions, it's always useful for us to be able to provide feedback to a one-page. We'll often use it as a specific AIMS format. If you have specific questions to that. Are there sites students are not allowed to go to, for example, Nigeria? This would be really specific to potential institutions about individual policies where those students are. So I would contact your local administrators. How can one connect for a mentor suggestion? So I would start with, what are you interested in? Who are mentors at your home institution? And kind of snowballing from there about who's doing work in the area. No substitute for reading a lot in the field to understand who are making key discoveries or advances that are respected and know how to mentor potential candidates. Yeah, so great questions. So, I want to hear more from you in a minute, but I do also want to make sure that we've got time for our esteemed alumni. So I'll maybe turn it over to Dr. Alida Gertz, who is a family medicine doctor who spent her year in Botswana working on improving family planning for women living with HIV in Southern Africa. So maybe Dr. Gertz, can I turn it over to you, please?
Yeah, can you guys see my screen?
Yep.
Yep.
Great, okay. And is the presentation coming through okay?
Yep, very nice.
Wonderful, okay. So thank you for that introduction. I'm Alida Gertz. I am an MD and PhD, soon to be MSc, and I was an HBNU Fogarty Fellow from 2018 to 2019. I was in Gaborone, Botswana, the capital of Botswana, and I was not there alone. I was actually joined by my 3-year-old daughter, who is featured in many of these pictures, and my mother, who is a retired nurse, and my husband, who was working on his PhD dissertation work during the time that we were in Botswana. So the biggest part of my year was the team that I worked with, which was an amazing team. It was the Botswana Sexual and Reproductive Health Initiative team, and it actually spanned 2 different institutions, the Botswana Harvard HIV/AIDS Institute Partnership, which is the institute that I worked with as a Fogarty Fellow, and then also the Botswana UPenn Partnership, which I had worked with in the past. The team was comprised of both PhDs and PhD students, physicians and medical students, and then a number of research assistants who, some of whom had master's degrees, some of whom were working towards master's degrees, and some of whom were bachelor's. So the team also was quite diverse. Most of the team were Botswana, but we also had team members from the US, the UK, and Australia. And importantly, I actually had known specifically the PI for the team since 2015 when I worked in Botswana as a family medicine resident at the University of Pennsylvania. And I had managed to keep in touch with her since that time. And when I found out I'd be going back to Botswana to work in 2017, I got back in touch with her and was lucky enough to start working with her team again for the time that I was there. It was an incredibly supportive team and a supportive PI. This is my PI here, Dr. Chelsea Maroney. And I was lucky enough to have a lot of support from family and friends while I was there as well. So I worked on a number of projects during my time in Botswana, and in addition actually to my main Fogarty research projects, I also worked on a number of additional research projects, which were mostly based in Botswana, but also a couple that were collaborations between groups in South Africa that Dr. Maroney had worked with in the past. And then I also did a little bit of work with one of the Fogarty, a couple of my Fogarty twins on a collaborative project. And then I also, during my Fogarty year, was finishing up a master's in epidemiology through the distance learning program at the London School of Hygiene and Tropical Medicine. And I started and finished a diploma in tropical medicine and hygiene, another distance learning program through Doctors Without Borders, an international certificate in sexual and reproductive health care, which I did with the help of Dr. Maroney. And I worked for 1 day a week in a clinic, which was actually a local Botswana started and run NGO called BOFWA, the Botswana Family Welfare Association. Down here you can see pictures of the clinic staff, and this is one of the nurse midwives who I worked with quite a bit. And that work was wonderful in that it allowed me to keep up my clinical skills, but it also helped with a lot of the research projects, many of which were actually based out of that clinic. And then finally, I did a number of clinical trainings for the Ministry of Health, mostly in family planning, and then also for the staff that worked at the clinic. So my main Fogarty projects were focused on family planning for women living with HIV in Botswana, and the project was actually sort of divided into 3 parts. So the first part was 2 systematic reviews, which were looking at barriers and facilitators to uptake of family planning among women living with HIV in Southern Africa. So for both of those systematic reviews, I'm currently working on writing up the manuscripts for those. The second part was validation of 2 survey tools. And both of those we translated into Setswana and then validated for use in HIV positive and HIV negative Botswana women. The first one was the London Measure of Unplanned Pregnancy scale, and then the second one was the Desire to Avoid Pregnancy scale. So for both of those validation survey studies, I'm also working on writing up the manuscripts at this time. The third part of the project was looking at the clinical utility of these surveys for use in actually providing direct family planning care for women living with HIV. And that third part of the project is actually just getting started. So the studies are ongoing, but hopefully will be finished in the next 3 to 4 months. And then in addition to my my main Fogarty research project, as I mentioned, I was also involved in a number of other research projects that were sort of related. So I ran and we're just now completing a pharmacokinetic study, which was looking at the interaction between etonogestrel, the hormone used in the contraceptive single rod implant, and different antiretrovirals. And then another study, which we've just finished up and are also writing the manuscript for now, looking at feasibility of integrating family planning care into HIV clinics. That study we did at the main HIV clinic located at the Tertiary Care Teaching Hospital in Gaborone, Botswana. And the outcome of that study, which was quite positive, actually led to formal integration of family planning care into that clinic. So now they are offering that as part of the care they give to women living with HIV. So that was a great outcome for that study. And then a larger umbrella study, which sort of was included a number of sub-studies, all looking at methods to develop different point of care tools to improve family planning method choice based on women's personal preferences. So I was involved in quite a bit of research during my year. And I would say overall, it was quite a productive year. And the keys to being productive during my year, I'd say, are we're staying busy and being open to collaborations, and then always sort of having a backup plan of what to do when your study inevitably gets stuck in ethics or the funding is delayed. In terms of ongoing work, so I am currently back in the United States, but as I mentioned, I'm continuing to work on a number of manuscripts from all of the projects that I did during my year. And then in my current position as core academic faculty for a family medicine residency training program here in Atlanta, where I'm currently working, I'm starting to develop a fellowship for family medicine residents that they can do after they graduate from residency to actually work with that same group in Botswana after they finish their residency training. I'm continuing to work on a number of ongoing research projects with the team, and I may, in the next couple of years, be applying for a PhD program. And of course, last but not least, the many incredibly valuable friendships that I developed over my time in Botswana. And I would say not just me, but also, as you can see here, my daughter made a number of friends during our time there. So what am I doing after Fogarty? As I mentioned, I'm core academic faculty for a family medicine residency program here in Atlanta. And I was actually hired for this position specifically because they were looking for somebody to help develop their global health and research curriculum. So I've been doing that for the program. And the training that I got from my Fogarty Fellowship year was immensely helpful for that. And I'd say I'm continuing to benefit from my Fogarty year. So it was overall an incredible experience.
Well, thank you very much. A big applause, I'm sure. I'm clapping here in Chicago. Thanks, Alida, for, great tour of, kind of where you've been and where you're going. So Patricia's asking if I can maybe hold questions for you until after Anubha speaks. So maybe if that's okay with you, and then you guys can both.
Yeah, absolutely.
Great. Okay, so it's my pleasure to next introduce Dr. Anubha Agarwal. Anubha is a cardiology fellow at Northwestern, second-year cardiology fellow, and was a postdoc back in 2017, 2018, studying heart failure quality improvement in India. So Anubha.
Thank you so much, Mark. Is everyone able to hear me and see my slides?
Yes.
Great. So I'm super excited to share my Fogarty experience with you. And over the next 5 to 10 minutes, I'm going to spend a little bit of time on the science of my research and more time on reflections on what kind of the year really meant for me, both professionally and personally. So I studied heart failure quality improvement and lived in New Delhi, India for my Fogarty year from 2017 to 2018. My primary mentor was Dr. Mark Huffman, who you have met. He's the director of the Center for Global Cardiovascular Health here at Northwestern University. Dr. Huffman and I had been working together approximately for 2 years prior to my Fogarty Fellowship, and it really prompted me transitioning to Northwestern after my Fogarty Fellowship to continue doing some of the work that we had started. My mentor based in India was Duriraj Prabhakaran. He is Executive Director, Center for Chronic Disease Control in New Delhi, India, as well as Vice President of Public Health Foundation of India. And he really provided oversight based in New Delhi and has an incredible vision of kind of cardiovascular care nationally in India. My third mentor was P.P. Mohanan. He is Vice President of the Cardiological Society of India and Head of Cardiology of Westport High Tech Hospital in Thrissur, Kerala, and was incredibly helpful in overseeing the research that was based in Kerala. So for my Fogarty year, I lived in New Delhi for 11 months and spent time commuting to Kerala, where my primary data collection occurred. So briefly, burden of heart failure has shifted predominantly towards LMIC settings, and unfortunately the outcomes remain poor compared to high-income countries. As Alida mentioned, one of the incredible parts of Fogarty is not only being able to do your primary research, but being able to collaborate with others. So we collaborated with authors that led the first heart failure registry in all of India, the Trivandrum Heart Failure Registry, and learned that only a quarter of patients were discharged on medications that we think all patients who have heart failure with reduced ejection fraction, meaning that their heart function doesn't work very well, should be on. So based on this information, we formed 3 specific aims for my Fogarty proposal. The first was to perform a systematic review to evaluate any studies that have looked at quality improvement interventions for patients with heart failure. The second was to use qualitative research to better understand the context in Kerala around patients with heart failure and providers that take care of patients with heart failure. And the last was to develop an intervention to target acute heart failure patients that were hospitalized to really try and increase the guideline-directed medical therapy that we talked about on the first slide. Our systematic review included 14 randomized controlled trials, and importantly, all of them were conducted in high-income countries. So this really provided valuable information on the importance of trying to do this in an LMIC setting, in India in particular. Our second aim was qualitative research. So I, along with my research assistant, did 21 in-depth semi-structured interviews, both with physicians, CCU nurses, and quality administrators to really better understand how are we taking care of patients with heart failure in Kerala, and maybe what can we do better. There were 6 main things that we came up with, and in the interest of time, I'll skip reading them off of this slide, but I think one of the main highlights was that there was a large gap between what the guidelines recommend for clinical care for heart failure patients and actual clinical practice. And so that was the gap that we aimed to close by designing this interrupted time series study, which was specific aim 3. So we enrolled over the course of 6 months, 1,400 patients hospitalized with acute heart failure, and designed an intervention that include a checklist, personalized audit and feedback reports where we took data from 8 different hospitals on how they're taking care of their heart failure patients and fed it back to them on a monthly basis, as well as patient and family education on heart failure. The comparator was usual care, and the outcome was prescription of guideline-directed medical therapy for patients with heart failure. And again, this was done over a 6-month time period to be feasible during a Fogarty fellowship. The data analysis and manuscript writing of that final aim is still ongoing. For specific aim 1, we published our manuscript in Heart. For second exploratory aim, we published our manuscript in Indian Heart Journal. And for the final specific aim, we will be presenting a poster at the American Heart Association of 2019 and have had the opportunity to submit it to kind of other avenues for young investigators. This last slide is to just show how incredibly productive a Fogarty Fellowship can be. I was fortunate to have 7 publications from my Fogarty year, 4 first author publications, and several as co-authors. Again, as Alida mentioned, an incredible opportunity to collaborate with others that you meet during your Fogarty year. So next steps for me, I'm a current 2nd year fellow in cardiology here at Northwestern, and I really hope to kind of continue working on global heart failure, and we'll be submitting an NIH grant at the end of this year, thinking about how to continue to improve heart failure in India specifically. When I think back on my Fogarty year, it was perhaps one of the best professional experiences of my life. As you can see, you can be incredibly productive, and it really set me on this path of tackling global heart failure, which is really something I hope to pursue for the next several years and decades, if not a career. I think personally as well, it was one of the best years in my training so far. You have this really unique opportunity to build new friends and community, colleagues who I continue to visit in India and see at conferences today, as well as time to explore, travel, and expand your horizons. So this last slide shows some of my mentors, Dr. Mark Huffman, Dr. Duriraj Prabhakaran, Dr. P.P. Mohanan, one of my co-Fogarty fellows, Kyle Yu, as well as my research assistant, Divin Davies. I'm going to stop here just so we have some time for questions.
Thanks, Anubha, and similar applause for you, for both of you and Alida. So thanks for sharing about your Fogarty year. So I know we're kind of had slotted 45 minutes. We're a little over, but we definitely want to be here to be answering questions to the attendees, and I know Alida and Anubha want to as well. So maybe I'll kind of ask Alida first, as people are thinking about questions. What do you know now that you wish you would have known when you were applying?
You know, I mean, I think one of the things that really helped me in the application process was as I mentioned, I had already been working with Dr. Maroney in Botswana, and she knew a number of folks who had both done Fogarty fellowships and were involved in mentoring for Fogarty fellows. And so I actually didn't know a lot about the Fogarty Fellowship. And so the first step I took was actually to meet with her and specifically talk about this opportunity. And I gained a lot of insight from that meeting, and obviously was a successful Fogarty applicant. So I would say there were a lot of things that I didn't know starting out, and just reaching out to her, and then to Dr. Shaheen Lockman, who was my mentor at Harvard, to talk to her even before I started the application process. And I would say that I feel like I actually knew a lot going into the application process, because I had reached out to both of those people, and had a number of discussions before even starting my my application, which was quite helpful.
Perfect. Thanks. Thanks, Alida. Anubha, how about maybe the same question for you?
Yes, thank you, Mark. I think what Mark had mentioned earlier, I will kind of rephrase and emphasize, is the importance of your mentorship team. So many of you have asked, what if I don't kind of know any of the current mentors? Are there other mentors that I can use? I think that Fogarty Fellowship time is short. You've got 12 months, and you may be fortunate to have some, prelim time before a Fogarty Fellowship or after, but having a strong mentorship team is key. And so I would spend a lot of intentional time reflecting on that as you're developing your Fogarty proposal, as to who are the members of my team that can really support me to be a successful Fogarty Fellow.
Great. Thanks, Anubha. Okay, questions? Well, not all at once. It's okay. Is publication requirement? I mean, I think the reason why we do research is not really for just publications, it's to improve health, but publications is a method of dissemination to our colleagues in the wider world about the work that we've done, so that people can either use the methods or the findings to be able to advance their own science, practice, policy, and so on. So it's definitely an expectation, Bokar, but I don't want you to think that, the publication is sort of the end line goal. The end line goal is really to improve health. So I hope that helps. Okay, well, not hearing a whole lot of questions. We're obviously available via email, but we've tried to put together a session today that would give you some information, have you a chance to interact with some of the alums, as well as some of us who help lead and administer the program. Yes, it is feasible to start applying now. The applications period is open. So maybe with that, I will turn it back over to, is it Patrici, to close the webinar?
If I could just say last comment from me, and then Patrici will close. Yeah, it's been a fruitful hour, I hope, and we'll be online. And you see the email addresses on the screen. Feel free to connect with any of them, myself included, and others. I think the overarching thing to end with is really to think of this experience as really a formative experience that we hope is foundational for developing those who go through the fellowship into sort of a leadership position in global health. So lots of opportunities for gaining experience. Publishing in many ways is important and is a kind of a signal of success. Developing proposals NIH applications or other applications that are really relevant. And then forming your own ideas and your own research projects and networks and partnerships with colleagues that you will learn from and continue to collaborate with. So it's an exciting opportunity. We hope you will apply, and we'll be happy to help you as you put together your application. Patricia?
Thanks. And Yashu, yes, the slides, it's being recorded. So this will be posted where, Patricia? Presumably on the website?
Yes, and we will send it a copy of the recording.
Thanks.
Good. Yeah, thank you, Mark and Wafaie, Alida and Anubha, and thank you everyone for joining us today and for your interest in HBNU. Just in summarizing a couple of things, I wanted to remind you of the November 1st deadline. And I wanted to ask you to refer to the website if you had other questions, or after you review the recording, if you have any question, feel free to email me, email Tara, or any of the PIs. We will be happy to answer your questions. Thank you again. Have a wonderful day.